These are 5 ways to know that medicine is the right career for you. What's up, fam? It's Dr. Dale, and this is Pre-Med Monday. Super excited to dive into week number 3 with you. Make sure you go back, check the other weeks. Were really just week 2. We combined those two. So make sure you check that out to get started. As a reminder, Pre-Med Mondays, grab a copy of your book. I'm going to put the link in the description below. And what we're doing is we're going through 52 weeks of me giving you some coaching to guide you on this journey, not just to get into medical school, but to become a superb leader in medicine, but also beyond the field of medicine, right? So, hey, thanks for listening. So we're going to dive right into this one. 5 ways to know medicine is the right career for you. All right, then go through the book, take notes of whatever you got to do so you can really think this stuff through. So number 1 is you want to help people. You want to help people. And even before I dive into this, let me just say this is important because I, the further you get in your career, and I've been doing this for a bit now, I guess, I graduated med school in 2010. So the further you get in your career, the more you realize, so the more you start seeing people around you who don't like medicine. And I don't want to say don't like medicine, they like medicine, but they're not sure if it was the right career. They chose the right field for them. Right? Somebody said, oh, I did it because my parents wanted me to do it. I did it because I knew it was going to make me a lot of money, et cetera, et cetera, et cetera. So this is very important. You want to be sure before you go into this field of medicine that it is the right career for you. It's a big deal, right? You want to be sure the medicine is the right career for you. So let's go into these 5 reasons. Number 1 is you want to help people, right? It seems very cliche. However, helping people is obviously what the field of medicine is about. Helping people, that's what the field of medicine is about. So when I say you want to help people, it's something you feel inside of you all the time. Like, you could ask my wife. It's from my wife and I've been together since we were pre-meds in college, right? We started dating a month after we got to college at the University of Missouri. So you can ask my wife, it's probably as long as she's known me. I would see somebody on the side of the road, something, and I would always want to stop. It was just my instinct to want to stop and help people, right? If I see somebody hurt, if I see, it goes all the way back. I think to when I was a kid, when I was even in high school. I remember one of my friends having a seizure on the court and everybody was just kind of freaking out, running. And I went to his side, I held his head up and did all sorts of stuff. He probably to this day doesn't even know I did that, right? All sorts of things that have happened in my life. My gut instinct is, oh, how can I help? How can I help? How can I help? And specifically, I'm talking about around healthcare, right? Other day I coached basketball. A kid got hurt and there's a trainer and everything there. But my instinct is still to go do the job of the trainer who's there, just because that's inherently who I am. And I enjoy helping people. I want to help people. I want to solve people's health problems. And I've always been like that. And I think that's something that all great doctors will have in them, is they want to help people. It's just a key instinct, a natural thing. I'll say that's the first indicator as to whether or not you want to be a doctor. That's the first indicator whether or not you can be a great doctor, is do you always have that inkling to want to help people feel better, right? So that's number 1. Number 2, you're curious. I remember one of my educators, one of my attending physicians when I was going through training could always say, difference between a good doctor and a bad doctor is good doctors ask why a lot. In order to be a great doctor, you're going to have to ask why. Why? Hey, the patient's blood pressure is low. Why? Right? The patient is not responding to the medications we're giving them. Why? Right? Oh, now the patient's kidneys are dying. Why? It's constant whys in medicine. And once you stop asking those whys, that's when you're going to see your patient not doing as well. Right? We're investigators. Especially, I'm a pulmonary critical care doctor, right? It's investigation, constant investigation. There are a lot of whys. When something's not going well with the human body, you have to keep asking why, until you get to the right solution that can be used to solve the problem for the patient, right? You keep asking why until you get to that right solution that can be used to solve the problem for the patient. People in medicine, great medical doctors are curious people. And if you want to be a great medical doctor, you need to make sure that you're a curious person. You're going to be saying why for a long time. That's number 2. Number 3 is you are patient, not the patients, but you are patient, right? Medicine is a game of time. It's a game of time, right? Sometimes you got to be really, really quick to get stuff done. That's actually most of the time, right? You want to do things as quick as possible to help the patient. At the same time, you have to realize that it will take time to get to the healing process, to get through the healing process. And if I'm being honest, a lot of what we do in medicine is buy time for the patient's body. God's created our bodies in such an amazing way that oftentimes they can heal themselves. Not always, but oftentimes. So what happens a lot of times is we're buying time for the patient's bodies to kind of get itself back together and heal itself. That's a big part of medicine. You have to be patient. That's that part of it. Second part, you got to be patient to get through the process to become a medical doctor. It's a long journey, right? I started this journey when I was I graduated undergrad at 17. I mean, I graduated college, high school. I graduated high school 17 years old, right? So I started college 18. I just turned 18. I finished all my training, I think, at 32 or so. So, you're talking 14, 15-year journeys for people. Some people was even longer, some people a little bit shorter. My wife's was a little bit shorter because she didn't subspecialize. She specialized, but she didn't subspecialize like I did. And some people go longer because they have longer fellowships or residencies than I did, right? It is a journey, and you have to be patient through that journey to get to the place you want to get to. But when you get there, let me tell you, after you've gone through all the training, after you've gone through all the medical school, when you get to the point where you get to be a fully licensed practicing medical doctor, it is so amazing. It is so amazing. You're going to go through, your life's going to be difficult. It's going to be challenging when you're going through the process. And honestly, if I'm being honest, yeah, it was difficult. It was challenging, but I loved the process. Medical school was some of the the most fun I had ever had in my life. People say medical school is hard. Medical school is hard, but it's so much fun. I'm trying to tell you, man, my medical school class, we're kicking it. We're going to parties. We're studying together, having a good time studying. My wife was a med student not at my school, but we went to different medical schools, but we're always with each other, traveling to see each other. Like, medical school was such a great time in life. It was challenging. It was hard, but it was still such a great time. What I tell people is, you're going to be doing something anyways for that time period from 18 till 32 years old. You're going to be doing something anyways. You're going to be doing something on a day-to-day basis. You might as well do something that you really, really enjoy. You might as well do something that you really, really enjoy. So be patient through the journey, but enjoy the journey. Enjoy the journey to getting there. Number 4, you've been exposed to it and you still want to do it, right? You've been exposed to it and you still want to do it. Again, reminder, we're talking about 5 ways to know that medicine is the right career for you. So, I remember when I was like in 7th grade, I think it was, for school, we had to go do some sort of professional project, go see a professional, and I went to go shadow a vet. I remember watching the vet do like an ACL surgery on a dog and almost passing out and leaving there, which is funny now in retrospect, right? Because stuff that I deal with. However, it wasn't even about almost passing out. I remember seeing that thing like, hey, I don't want to be a vet, just from watching what the vet did and stuff like that. And before that, I could have thought about, yeah, it might be cool, but I left that like, I do not want to be a veterinarian. You want to expose yourself to the field of medicine to know if this is what you really want to do. So, to get into medical school, to talk about getting your shadowing hours, and so many people just shadow just to get the amount of hours that they want. But then they're missing the point. The point of shadowing is not to get the hours. The point of shadowing is to fully immerse yourself in the medical field to see if medicine is what you want to do with your life, right? To see if you really want to be a medical doctor, if you can do this day in, day out and be fulfilled as a human being. That's the point of shadowing. So don't let that go over your head. Don't say, okay, I want to be I'm pre-med. I want to be a medical doctor. Let me check all the boxes. I did my research. I'm getting the grades, MCAT, shadow check. Shadow box is not a check. Shadow box is an experience you want to immerse yourself in, so you know if this is the right field for you. You might get through it, and then you really need to be thinking this through as you're going through the shadowing process, because you might say, you know what, I don't want to do this. Medicine is not for me. And that's a good thing if you come to that conclusion, because what you don't want to happen is you don't want to invest so many years going to medical school, going in debt, loans, and not even the money, but the time and stuff like that, and realize, man, I didn't want to do this anyways. I got to go back and start over at the drawing board. So expose yourself to it. When I say expose, I'm not talking about just watching it on TV, not Grey's Anatomy or whatever TV shows that they have. I'm not talking about that. I'm talking about get up out your butt, get into a medical environment, have real patients in front of you, spend full days with doctors, seeing your lifestyle, what they do, how busy they are, how stressed they look, right? Or how much joy and fun they're having. Go through that and see if it's for you. It needs to be for you, not for your parents. This is coming from the guy who wrote this book, How to Raise a Doctor, right? So I'm trying to tell you, it needs to be for you, not for your parents. All right. And number 5, nothing excites you this way. Nothing excites you this way. I'll tell you, me personally, there are 2 things that really get me excited, career-wise. 2 things. Number 1 is medicine. I love medicine. Number 2 is public speaking, right? But that's all part of my medicine stuff anyways. I'm a public speaker. I love speaking. Those 2 things get me so excited, right? I love taking care of patients, and I love speaking to inspire, invigorate, motivate, encourage people. Those are the 2 things I do. And in medicine, it's all together. It all fits into my life now. It's phenomenal, right? And I'm so excited when I get them. I'm so excited when I go talk to patients. I'm so excited when I get to do all these things, right? That's the feeling you want. You want to, man, I'm excited just going through, just telling you about it. You want to wake up like joyful of what you get to go do, right? And nothing excites me the way the medicine and speaking excite me. Those two things. No other field career, nothing excites me that way. So I know it's right for me. So it's such an easy thing for me. It's not, it's never a thing I have to say, man, maybe this isn't for me. Now, am I going to practice medicine till I'm old? I don't know, right? I love it. So I imagine I'll probably always practice medicine to some extent. But I just can't think of any other field that I would rather do if it's not this kind of combination of medicine and public speaking, right? So figure that out. 5 things. Let's recap them really fast. 5 ways to know that medicine is the right career for you. Number 1, you want to help people, meaning you see somebody hurting, you want to take that hurt away. Number 2, you're curious. Great doctors ask why. You're going to have to ask why a lot. Number 3, you are patient, not a patient necessarily, but you are a patient person. It's a journey to become a great doctor, right? And sometimes it's a journey to take a patient from sick to well. Number 4, you've been exposed to it and you still want to do it, right? You have to immerse yourself in the experience and make sure it's right for you. And number 5, nothing else excites you the way the medicine excites you. All right, let's get to the homework assignment for this week. This week's assignment. So go through these 5 items and ask yourself, answer all these 5 questions, these 5 things we just went through. Go through each one of them and ask yourself, is medicine the right career for me? Is medicine the right career for me? And of course, as always, discuss it with your accountability buddy. If you don't have an accountability buddy, make sure you have one. You need to have one, okay? Right? Drop some, if you need one, write in the comments below. You guys engage with me in the comments below. Drop some comments and I'll engage back with you guys in the comment section. And you guys, hopefully you guys know Pre-Med Mondays is not just these videos, and it's not just my book, but we actually have coaching sessions. So every Monday night we've got Pre-Med Monday coaching sessions. All right. So if you're interested, drop some comments below and we'll get you that information as well. All right. So discuss these things. We're here for you. Want to go on this journey with you. So what happens now? 2 things you need to do. Number 1, hit that subscribe button so you make sure you don't miss any of these videos. I'm here to walk this journey with you, give you some information, some guidance. Just going to keep on getting better and better and better to help you not just become a great doctor, but to become a great leader and contributor to society. Right. Number 2, YouTube knows what you like. So YouTube's going to show some videos around here. Right. Go ahead and click on the next video. Keep growing. Keep learning. Love you guys. You have permission to be great.